Yes, ma'am. So, hello all. Welcome to the sixth day of live program. So today we have Dr. Meera Sudheer. She's an Ayurvedic expert. We're going to have a conversation on live with her. So welcome you, ma'am.
Thank you so much. Yes.
So, yeah. So a brief introduction about you, ma'am. This is Dr. G. Meera Sudheer. So she's done in bachelor's in Ayurvedic surgery from Venkataramana Ayurveda College, Mylapore. Her master's in Rasa Shastra from NRS Government Ayurveda College, Vijayawada. She held position of lecturer at Sri Jayendra Saraswati Ayurveda College, Chennai, Department of Rasa Shastra. Her classes were always power packed and highly interactive, according to her students. Her good command in the subjects and her dedication to Ayurveda makes her a sought after. Right now, she's a part of Sri Ariham Ayurveda, where they work on positive medical counseling, administration of Panchakarma therapies, preparation of diet charts, conducts Ayurveda classes for yoga practitioners at Yoga Vahini Foundation, conducts Ayurveda awareness program among the public, enables the public to visualize Ayurveda as an active healthcare system for any health issues, and researches to revalidate Ayurveda. She has participated in numerous oratorical competitions and debates in English, Tamil, and Hindi. An avid rasika of Indian instruments and dance, she is irresistibly smitten by the literature, arts, and sciences, by the Indian subcontinent, and the unseen Ayurveda threads that holds them together. So you are a multi-talented woman, ma'am. So welcome you, ma'am.
Thank you so much, Mahesh.
Yes, ma'am. Ma'am, as you know, we are in coming in 3 days. We have World Conference on Advances in COVID-19.
Yeah.
So this is the situation where various factors have brought up that we have to conduct a conference.
Yeah.
So what is your opinion at this current situation and pandemic, ma'am?
So the current situation, it's been almost 200 or more days, right? 8 months. If it's December 25th, we are going to reach August 25th, 240 days. And not a single medicine has been declared 100% safe or 100% effective by the World Health Organization, which we all know. Vaccines have not yet been launched. The virus is yet to be deciphered. So an epidemic strikes, and it's 8 months, and the number of deaths across the world is also high. We have reports from the ICU that 96% of the people who are admitted or put on ventilators, there's every possibility that they die. The Ayush community has been shouting at the top of the voice from day one that Ayurveda can prevent and cure coronavirus successfully. Our words were not taken seriously. And it's been only since 2 months that we have been allowed to practice on coronavirus patients. And we at our clinic would have seen around 300 patients related to corona, primary and secondary positive, mildly symptomatic, moderate symptomatic, and who are also all these moderately symptomatic COVID cases becoming a little severe when the hypoxia sets in. Today, I tell with confidence that the hypothesis which we had given that Ayurveda can prevent and cure corona stands justified and proven. And I tell you with confidence that Ayurveda has cured coronavirus patients, because I've got cases which have become positive, have become negative, and all the parameters have come down. We have parameters which we'll be sharing in the conference. The D-dimer values are well within the limits. And even in severe cases of hypoxia, where the oxygen level reaches 80 to 90, sudden lowering of oxygen when it occurs, even then, Ayurveda medicines have helped in reviving the patients and avoiding their admission into ICU. So Ayurveda doctors feel that this fear towards corona is unnecessary, and when Ayush system is brought as a mainstream in not just India, while across the world, the number of deaths in ICU can be successfully arrested, and we need not wait for vaccines, and we can go ahead because we have proof.
Yes. Ma'am, coming to Ayurveda and allopathy. So, how do you define allopathy in terms of Ayurveda? How do you this?
Very. You didn't ask me whether what is Ayurveda. You didn't ask me what's allopathy. How shall I define allopathy? How do I view allopathy? See,
Yes, ma'am. Ma'am,
with the
yes,
passage
yes,
of,
yes.
yeah, it's a very interesting question. See, Ayurveda is a totalistic approach. And although the microbes have been explained in Ayurveda, we have different types of krimis which have been explained in Ayurveda. We don't believe that 100% these viruses are the causative factors for diseases. So allopathic system is is very young and it's just in the nascent stage, just 200 years, while Ayurveda has been in practice in India for 5,000 years or more. The universe only knows when it had begun. I shouldn't even call it 5,000 years. It could be even more.
Yes, ma'am.
Ayush system, including yoga, Siddha, and homeopathy. I don't. Homeopathy is very nascent, and even the Unani system of medicines has got a tradition. You know, a tradition which speaks for 5,000 years. We should be really proud that we are the carriers of this tradition, the philosophies and the scientific theories which have been put forward by scientists and which have stood the test of time. So that is Ayurveda. And allopathy is very nascent and it understands the body by a reductionist approach. They look for parameters, they look for increase in chemicals or estrogen or hormones which occur due to when a virus enters, and they understand this virus attacks your tissues, and there are these ACA inhibitors or whatever they call. I'm not a right person to explain it, so that's what I understood. And when they find that this virus attacks the probably the blood, and the red RBCs, you know, break, or and when these clots are formed in the body, they get worried because they feel that this clot can lead you into a stroke, or this can lead into heart attack or paralysis. So this is all because they look at one chemical. So we don't look at one chemical which is getting increased in the body, or we don't look at one ACE inhibitor, but we look at the body as a whole. We look at what are the symptoms which the patients express when this infection sets in, and we try to manage these symptoms with the Tridosha Siddhanta, the Tridosha theory, Vata Pitta Kapha theory, and we are successful in this approach as proven by the results, because we have COVID positive people becoming negative and the D dimer values are within control, and clots are not getting formed. So I really feel, is this reductionist approach helping us? It's been 240 days, I again tell you, and this reductionist approach has not helped in saving the people from dying in the ICU. So should the allopathy system also look at the body as a totalistic view through the Ayurveda's lens? Because I've done mild cases, I've done moderate cases, and now I feel mild and moderate cases should be managed by allopathy, and the intensive care unit patients, as they themselves declare that they are 96% failure in ICU, Ayurveda and Siddha system of practitioners should be allowed into an ICU, or their medicine should be administered in intensive care unit for two reasons. One, to save the dying and to reduce, reduce the curve of the curve of COVID. The curve of COVID must be broken. And two, for the doctors who have to come out of this PPE kits, who are struggling wearing these PPE kits for 48 hours, they should come out and breathe freely. So that is my point. Ayurveda has a totalistic approach towards the body, and it has been proven successful in this COVID scenario, while allopathy probably has a reductionist approach of the body.
Yes, ma'am. Thank you, ma'am. I asked this question because now people, they are just coming up with ideas. No, there are so many creative ideas in coming up allopathy and Ayurveda, and everybody knows about Ayurveda system and allopathy system. So I wanted you to just tell me the what is happening in Ayurveda, how efficient it is, and how potential it is. Thank you for that answer, ma'am. And coming to ICU, you were telling about management in ICU. So when the allopathy system is also managing the ICU, and Ayurveda system, as you told, it is managing. I should not ask this. How better is Ayurveda from allopathy, ma'am, coming in ICU treatment?
See, one thing is I have not yet gone into an ICU, but I get cases which are discharged from the ICU. When you come out of an ICU with a corona situation, you are admitted in the hospital for 1 month. You come out of the ICU. If you are coming out of an ICU, it means that you have a comorbid condition. You should be either a diabetic or you will be having a heart problem or an hypertensive or an overweight person. Such
Yes,
people
ma'am.
are admitted in the ICU. So when you come out of the ICU or from an hospital, what are the medicines you are put on? You are put on steroids. Are steroids are good for your health? Is it going to cause
No.
any good for your health?
No.
You're put on anticoagulants, and when you're put on anticoagulants, how many years is it going to take for you to come out of the anticoagulants? Will you ever stop these anticoagulants? What are the effects of these anticoagulants on your body? And are you removed of your oxygen mask? So we have patients who are on oxygen mask, who are on steroids, who are on anticoagulants, who are on antidepressants because of wearing this, a mask always, who are on antibiotics, and it's getting complex. But you go to an ICU to get cured, but when you come out of when you come out of an ICU, neither you don't get even a negative result in your COVID. Your COVID, you come out of the ICU with a COVID positive result, and also inclusive of it, you have got so many medicines to consume. So how has an ICU helped? It's my question. I'm not the judge. How has an ICU helped? You see patients who are coming out of it. You must reply, right? So an
Yes, ma'am.
ICU has not helped the patient in any way. So why not? If I have a different approach in addressing this, if I tell that I can help you with medicines which don't create increase in the D dimer value, which don't create clots at all, where if I'm going to suggest a herb by which you need not put the patient on steroid at all, if I am going to suggest you with some dietary practices by which you need not put the person on antibiotics at all, how nice is it, right? Because we have proof. We have patients who have drunk Indukanta Kashayam for 2 months, and their ejection fraction of the heart has increased from 35% to 45%, which means it helps in functioning of the heart, right? And the oxygen hypoxic conditions from 80 has become 95 in a matter of 3 days, which means you need not be on oxygen cylinder for 1 or 2 months, but can come out of it in 3 days. Your dependency on these scientific, instruments or equipments, which again make put you in a depressive mode. Such things can be avoided when Ayurveda and Siddha medicines are included in ICU.
Wow, that's great. Ma'am, coming to the conference,
Yeah.
what do you feel about this conference? How important is this conference for you as a traditional medicine doctor or Ayurvedic doctor?
So I had been to this conference for the first time in last month. When was the date?
It was
You
from
rem-
7th June, ma'am.
yeah, 7th June. So it was, we never knew this center, the Bangalore Genomics Center, but we accepted because there were biotechnologists involved. We saw the word bio involved in it. We know that when bio is involved, there would be understanding of more of Ayurveda, because people who are botanists, people who are biotechnologists, or people who are bioinformatics, you know the value of plants. So when you know the value of plants, you know also the value of Ayurveda. So that is why I thought I should join this conference. And it was an amazing experience because you have Professor Malali Gowda, you have Professor Gustav and Natalia, and we had listened to these talks. Although we had not actively, conversed with these people, the researches they have been doing, I feel, are on lines of Ayurveda. I had already told it to Professor Gustav because Professor Gustav works in an high altitude pulmonary center. So, and he studies the effect of high altitude on patients. So, this is what Ayurveda speaks of in the first chapter. In Charaka Samhita, they tell that how a person born in different desha or different places based on the altitude or based on the climatic condition, the nature of a person changes. It's called the prakriti or the constitution of the person changes, number one. And two, the reaction of a body to a disease also changes based on the place in which you are born or brought up. Okay. So I found that the research center of Professor Gustav, which they have been doing for 3 generations, is
La
fantastic.
Paz, it's in La Paz, Bolivia.
Yeah, in Bolivia, it's really fantastic. And we must aim to bring in such research centers which work for hundreds of years together, because you understand one organ properly with respect to one criteria, which is altitude. So if such centers are, established in Himalayas, if such centers are established in Ooty, so or in Coorg, it will be wonderful to understand and compare the effects of what is change in birth of a person bring in the body. So this I feel is perfectly goes along with the principles of Ayurveda. So it was an eye opener for me. And after listening to the topic of Gustav's efficacy of efficacy, no, the better response of his COVID patients who are suffering from hypoxia in high altitude, it gave me some reassurance as an Ayurvedic doctor to take up cases of hypoxia, because I knew that when Gustav can manage COVID successfully with his medicines in high altitude, even with hypoxia, I knew that Ayurvedic medicines will help hypoxic conditions. So I got lots of reassurance from the points of Gustav, and I'm looking forward to listen to his speeches. And to all physicians across the world, you have clinicians from Europe, you have clinicians from Italy, you have clinicians from UK, you have lots from Mexico, Peru, and South Africa. So this is very important for all doctors across the world to share their researches and experiences, because this is a new condition. This is an out of blue, virus which has not yet been deciphered. So how is a physician managing his patient? It is very vital to understand between two doctors to find out if we are lacking in some aspects and to improvise us. So it is very important for clinicians to participate in this conference, and it is even important for the general public, because the general public don't know science. They don't know what is vaccine. They don't know what is Ayurveda. They don't know how a doctor is managing a patient. It is very important that every person in India must participate in this conference, because they will then know what is the value of Ayurveda. They will then know how the Western countries have opened their doors for the Ayurvedic system of medicine, which many Indians don't trust at all.
Maybe, ma'am. It will be an eye opening for everybody who
Yes.
haven't joined the session.
Yes. And especially, I should also add, Mahesh, all media persons should add. Media persons should join this conference, because the media people were the first one. On as early as January 26th, the central government had issued a notice requesting Indians to consume Ayush immunomodulators to improve their immunity as good as a vaccine to prevent themselves from coronavirus. You know what, Mahesh? We never got a single call from the public. The media was up against the government, telling that you are forcing some outlawed, some forgotten concepts in the name of science. It is a pseudoscience, is what Ayurveda was laughed at. But now it is August. Ask the media persons to join this conference. They will know what is a virus. Has a virus been found out? Has a vaccine been found out? Has a medicine been found out? And why not Ayurveda then? Just as the allopats have repurposed hydroxychloroquine, just as the allopats have purposed their antiviral drugs, and you know what? Azithromycin is given for coronavirus. Can you believe it? For a viral infection, antibiotics are administered. Shouldn't the media wake up now? And even now, if they are not going to take their Ayush immunoboosters, I cannot help them. So for them to understand what is science, every media person, every common man, and every Ayurveda doctor and every allopathic doctor, any scientific stream should be a part of this conference to understand what is science and to take care of their health.
Yes, ma'am. Surely, we will look. We will invite few of the media people for this conference, because they should know what is happening, where what is happening at different disciplines of science. So they can't just boost out blindly on telling some things unrelated to the pandemic. Ma'am, we have great speakers in this conference, no doubt about it. So they will come and share their thoughts, their research work. So how benefit it is for the current people? Like for example, I'm a layman. I don't know nothing about science. How effective it is for such a person to attend this conference?
See, science is taught from textbooks in in any country, but is it the real face of science? We still
No.
study of Louis Pasteur, who found out that microbes cause diseases. But do we still accept the germ theory? If we had accepted the germ theory as the germ is the causative factor for a virus, then why should we find out a vaccine? We are doing a vaccine because to increase the body's immunity, and then we tell that the body probably may not get affected with coronavirus, right? So
Yes,
if Louis Pasteur's theory is 100% acceptable, then why should we find out a vaccine? We should just find out a medicine which will act as an antiviral, right? So it is such
yes, ma'am.
theories which, and we still keep, clinging on to such theories. And science keeps changing. The modern science keeps changing. But such things where the germ theory has been questioned by many scientists across the world. So such new lessons must be included. What is Bicham's theory? Why is it not taught in science? We just take principles which are which the industry likes. That is not how science should be taught. Science should be taught. Every person must know how effective is the vaccine. How effective is the vaccine, Mahesh? They tell if 30% efficiency is shown, the vaccines can be administered to the public, right? If
Yes,
they
ma'am.
just want 30% efficiency, then why not take your Ayush medicine, which may even show 50 or 75% efficiency? I have cured, I tell you, I have made COVID positive cases becoming COVID negative in 3 days, in 5 days, in 7 days, and 14 days. So when Ayurveda medicines can cure a condition in 14 days, Ayurveda medicines can prevent a condition by, prevent its spread. Then why at all we need a vaccine? Such questions must be discussed by the public. The public must know as to what is a vaccine, why is he administered, what is the preservative used. They must know this, but our public, the layman is not at all bothered. All he wants is to take a vaccine and go to work. He just doesn't think of what is science. So it is very important for every person to understand science through the real scientists.
Yes, ma'am. So it becomes then if whoever attends this conference, it will be like eye opener. So
Yeah,
they will
just an
come to
eye
know.
opener. Yeah, and you will know what you will get millions of thoughts. You will
Yes,
not
ma'am.
get. It's not a lottery ticket. You will not win millions of money. You will not. It is not a place to earn money, but you will get millions of thought processes, especially young scientists, young budding students.
Yes,
You
ma'am.
just one thought. For example, I shared, right. I had one thought of Gustav telling me that hypoxia can be successfully managed by Ayurveda. You will get millions of such thoughts, and you will not have enough time. It is going to be like a T20 match, and you will be always with your pen and notebook, writing, writing, and writing, and it will take lots of months to understand the notes which you've written.
Yes, ma'am. So very true, ma'am. So this conference is really going to be a very great platform for each discipline of science, because as you said, people from traditional medicine of Ayush, Unani, and even from various physicians, various scientists from different altitudes and different regions of the world, they are coming and participating. So they will share their own thoughts. So when thoughts come together, you will get an idea of what we have to do at this particular point. So how we have to proceed in a particular, stepwise, so that we will get a cure for this pandemic. Your words on these, ma'am?
See, speaking within the four walls is different, but coming
Yes,
to
ma'am.
a conclusion is different,
Yes, ma'am.
right? So we
Yes,
speak
ma'am.
of so many concepts. We've been speaking of so many concepts. The conferences have a very beautiful exchange of views, and they should be put into action. So how can it be put into action? That the government decides. So there
Yes,
is,
ma'am.
for any matter in the world, there is a social, there is an economic, there is a political, there is a scientific, and aspect of every aspect, aspect in the world, including the COVID epidemic. So at last, it is the industries which decide as to what is important, what is not important. But should it be so? Will this conference change, the way the industry reacts to an epidemic? We have to wait and watch.
Yes, ma'am. At least for this, for people who are wanting the change, at least for this, I hope people will come and join this conference. So yes, ma'am, it's the time we end the session. So thank you, ma'am. It's really been a great talk with you, and
Okay.
people would have what you have boosted the people's memory like something like they should, and they should come and join the conference. Very great talk, ma'am. Thank you, ma'am.
Okay. Thank you so much, Mahesh. Good day.
Yes, ma'am. Thank you, ma'am. So all the viewers, you have just heard Dr. Meera's talk. So you know what the conference is about now. So please come and join the second World Conference on Advances in COVID-19, which will be held from 27th to 30th of August 2020. So hoping that you all join, and we will see you on the conference. Thank you all.
Mahesh, was it okay? Your audio is muted.
Ma'am, you stay on the live.
Yeah.
She will end the live, and we'll